B6. We know magnesium is so vital. We know calcium is vital. We know all these things are vitally important for biochemistry. We know the mitochondria does not do well without CoQ10 and carnitine. You can't start with carnitine. You got to take care of the various methods to make the child turn the corner first. And in my book, that's fixing the gut. You fix the gut first, you fix the brain. So we have to think outside the box. I don't do the same test on anybody except for these first two tests. My first two tests, a person comes in with autism, as I do a comprehensive digestive stool analysis to find out what's going on in the child, to determine how to control the abnormal flora, and is there an underlying yeast overgrowth. And I do a hair analysis. Hair analysis determines heavy metal exposure and vitamin deficiencies. I slipped and I said vitamin D deficiency because everybody has a vitamin D deficiency. So please check your vitamin Ds. Vitamin D labs will say is normal between 30 and 100. It needs to be between 60 and 80 for optimal health. Getting a blood test and it's 32, he's fine, he's not fine. Because you're going to have a problem. There's a huge problem throughout the world with vitamin D deficiency. But the hair analysis is fantastic. I'm going to go into it a little bit with some slides in the future. But these are the first two tests I do on every autistic child. And I do that on non-autistic kids as well. Because we want to know, in 6 months, what is going into the body. I mentioned that faucet in the bathtub before. My hair analysis, the analogy I use for the faucets, what's going into the child? Are they zinc deficient? Do they have a calcium magnesium deficiency? Do they have a cobalt deficiency? Well, cobalt is cobalamin. And we need methylcobalamin for our kids. So everybody knows methyl B12 is so helpful to get that folic acid cycle to make glutathione. So we want to do what we can to help the body in various methods. And then I do, for some kids, once we get them balanced, I want to see not only what is going into them, but actually what can be brought out of them. So I put a magnet in their system. Hopefully that works. No. They said that might happen to me, and I'm not supposed to repair it that way. So we do a urine chelation challenge to help determine what is going to be coming out of the person. Does anybody do chelation therapy in their office? No. So I'll explain a little bit how that works while I'm waiting for this. Hopefully I'm not going to work. To chelate means to grab onto and remove. So if we want to find a way of putting a magnet into the person to pull out metals in their system, we give them chlorella or cilantro or garlic as good chelating agents to pull metals out of the person. But the effectiveness is so minuscule. We give them zeolite clay, we put them in clay baths to pull it out through their skin. But again, it's very minimal in the effectiveness. You need to do something pretty strong, safe, to make it work. So when you get trained in how to safely do this, and I did that through the ACAN conferences, you end up learning what can I do to put a magnet into the person and pull the metals out of the system or the pollution. You can go into a infrared sauna and sweat some of the stuff out of you. We excrete through our skin, through our urine, and through our feces. That's how we get rid of vitals. And the idea is that how can we enhance the product? So chelate, to grab onto and remove, an agent is given to a person that's safe and effective to grab onto and remove. And it's usually given serially. So what I would do would be a hair analysis on a person, find out what's going in. Okay, let's fix that person first. And when we fix the person, I mean, get their gut working better, do the probiotics, find out what bacteria are working in their system in overdrive. And then you can get the gut repaired, and the person's starting to be, hey, I got a couple more. Get them on a gluten-free diet and a casein-free diet. 65% of the kids do better with a gluten-free, casein-free diet. There was a group called Autism Research Institute that the parents would fill out forms on the computer to see what therapy worked for my child, what therapy did not work for my child. And 65% of the time, a gluten-free, casein-free diet showed improvement. The thumb went up. 60% of the time, melatonin improved. 62% of the time, hyperbaric oxygen improved. 10% of the time, Prozac improved. And these other drugs that we are giving to some of these kids. So it's a really good way of looking at what therapies work fantastic. Magnesium and B6, zinc, vitamin D, all having good positive responses. So we want to try to find ways to help that human frame recover. So once we get the person balanced, and then we can work on that topic. Thank you for trying this. So when people go in for, like I said, they do the hair analysis, they find out what's going on with the system. If I can get them improved and they get their gut controlled, then I can consider various modalities. So what I usually do at that point would give them an oral DMSA challenge. DMSA is a sulfur-based item. It's a safe product. It's indicated for lead overburden. Realizing this DMSA product can lead to yeast overgrowth. So there's a problem with yeast and sulfur products. So you have to really fortify the person with probiotics and Saccharomyces, which is a good yeast that comes from the skin of a lychee nut. And improve the gut to the point that when you give them this agent to try to help you with the detoxification methods, then you will get the resulting response. So we give them the DMSA challenge, 25 milligrams per kilogram, and we collect the urine for 6 hours, and we find out what comes out of that person. Once we find out what comes out of that person, we know what their body burden is, and then you can serially treat them by giving them DMSA. It's 10 milligrams per kilogram 3 times a day for 3 days in a row, and then nothing for 11 days, and continue on, and then collect your urine to see that the amount that you spill becomes the amount that you spill, becomes the amount that you spill, and the parents say, wow, the kid's behavior is getting so much better. I'm noticing improvement with each round of chelation that we're doing. So we find it very helpful as one of the methods. But you need, like I said, you have to balance that person first. While we're having technical difficulties, does anyone have any questions on the earlier portion that I can discuss at this point? Because there's a lot of other speakers. I don't want to take up their time by just standing around here and not answering any questions. Anybody have any questions on what I spoke about so far? Yes, ma'am.
How much is the dose of
DMSA, a loading dose, would be 25 milligrams per kilogram. You want to make sure they have no sulfur allergy, and you can give it to them. What I would do is I empty that bladder ahead of time. If you can collect the urine for 6 hours, it's great. If you have to do stool, it's not so effective because you don't know when they last had a bowel movement, because most kids on the spectrum have BMs every 2 to 3 days. So, and then you may not be collecting just what the DMSA is giving you. So urine is by far better tonic. And then you would collect the urine for 6 hours. And every time that urine gets throughout the day, it's a 6-hour period, then you send it out to a company. I use Doctors Data in the United States. They're really paramount in heavy metal diseases, or measuring, I should say. And then you would end up with a DMSA challenge that shows that you have this amount coming out of you. So it gives me a picture of the body burden. Just going to see if I can fast forward down here. Right with you folks. So, we're back in, right? Okay. So after we've done the detox program, and if we have gotten improvement with getting their metals down, or even if we're starting to see repair, then I would institute a form of mild hyperbaric oxygen therapy to reduce the inflammation and improve oxygenation. And we'll talk about how that works in the view as well. So this would be the urine challenge results. It's so much easier when you have slides to explain this stuff. of a person who has a problem with overburden of antimony and arsenic. This is a 7-year-old Asperger's kid who has a huge amount of arsenic coming out of him, and antimony, and tin, and the total toxic representation is augmented because these all are tremendous problems in our environment we have. And where do we get these items from? Well, our environment must be as clean as possible in order to maintain optimal health. And you really need to think about every little thing that goes into these kids all the time. A drop of gluten on a gluten-free child, you'll see the response for up to 3 months that you might see the eradicated. Environmental exposures occur throughout pregnancy as well as through the childhood exposures in life. You have to think about what is causing the problem. Mercury we have in vaccines. Still, some vaccines, even the flu shot, they say there's no mercury in it, there's some mercury in it. Dental amalgams and fish. Usually it's the larger the fish, the higher they are on the fish cycle, like the predatory fish, the larger the fish, the more smaller fish they eat, therefore they have more concentration of mercury in their system. Lead is in the air, it's in the paint, it's in pollution from the air, it's in water systems, it's in those solder in the pipes. I had a patient of mine, adult patient with chelating for cardiovascular disease, and we ended up chelating her for quite a while, and her cardiovascular symptoms got a lot better, less claudication, less angina. But she says, how am I getting this lead? I am really good. I have only plastic pipes in my house. I don't have any lead from the solder. I said, okay, let's do a hair analysis and find out what's going in. Is lead still going into you or not? Because we see it's still coming out. Are we still getting an exposure? And lo and behold, her hair had a lot of lead going in. I don't use hair dye colors. I don't do this, that. The next thing, I said, okay, tell me what water you drink. Oh, I have a Brita filter. I have a filtration mechanism. I use a Brita filter. I pour it into my crystal pitcher, and I put it in the refrigerator. I said, crystal has lead in it. So she wasn't even thinking that little thing that all crystal has is lead crystal. So she was getting lead contamination from crystal. We've had people who have all ceramic plates and have lead inside the plates. If there's a crack in the plate, you're getting lead going into your food. Think about all these little things. Aluminum is in cooking materials. People have aluminum foil wrapped around their food. They take antacids with aluminum hydroxide. Teflon, coated cookware, has aluminum. Vaccines have aluminum in it. Aluminum is linked to Alzheimer's in this world. We actually do detox of people and get the aluminum down, and some of their memory issues improve. We're not going to reverse their Alzheimer's, but we're at least going to help improve that topic. Cadmium is in water. Cadmium is all over the place. It's one of those items we really need to be improving in our society. It's in batteries. It's in secondhand smoke. It's in paint. In the United States, McDonald's is big. I think McDonald's is pretty big here as well. When the movie Shrek came out years ago, they handed out free glasses to people that come to McDonald's and get a little movie, get a little token to celebrate by a Happy Meal, and you get a free Shrek glass. The paint on that glass is 100% cadmium. But they don't pay attention to this stuff, and that's what we need to do, is pay attention to how our environment plays a role in our health. Arsenic is in the water. It's in organic brown rice. It's in the water. It's in shellfish, in apples, and in chicken, and eggs. Please, everybody, share this website with your patients and your families. It's called www.ewg.org. It's the Environmental Working Group. Every one of my patients goes home with this to look up. And there's a fantastic application for your phone that's called Dirty Dozen. Dirty Dozen talks about the top 50 fruits and vegetables in the United States, on how many pesticides there are on which fruits and vegetables. So which ones must I buy organic? And in the United States, USDA organic means organic. A lot of things will claim inappropriateness. But USDA organic is organic. So apple's the worst offending agent because it's the most pesticide-laden fruit we have. You want to make sure people are aware of what foods can have a lot of pesticides, like avocados are the least pesticide food, and nectarines and peaches are very high up on the list. So you want to think about what foods must I buy organic versus what foods don't feel organic. Flame retardants are have antimony. The gunpowder has antimony, and cloudy plastic. Cloudy plastic, what we in the States get milk containers or apple cider containers, and you can't see through that plastic bottle. I call that cloudy plastic. That usually has a number 7 on the bottom. Your number, as I mentioned before, number 3, number 6, and number 7 on your recyclable labels, you should try to avoid because that puts more chemicals inside your child as well as yourself. And then tin, titanium, nickel, and silver, we find that in canned goods. And some fillers and poor quality vitamins will have titanium dioxide as a covering to make it easier to swallow. So when I was out in Vail this past year, there was a great sign that, said no heavy metals. I always talk about avoid heavy metals. It was perfect. It was a ski slope named heavy metal. Avoid fish high on the mercury chain. Absolutely, you do not want to be playing with a great white shark, but you don't want to eat shark, swordfish, tilefish. Because if you do, then you're going to end up with a lot of mercury coming out of you. This person probably had a lot of flame retardant clothing they were sucking on and eating a lot of tuna. Tuna fish is loaded with mercury as well. So the EPA recommends a safe maximum daily intake of mercury. Mercury is a toxic metal. What is a safe level of a toxic metal? 0. But they say you can get by with 1 microgram per kilogram per day. So the average 70 kilogram person is 7 micrograms a day. 1 dental amalgam, that we still put in the States, because insurances pay for mercury to go in your mouth, but they won't pay for porcelain to go in your mouth. 1 dental amalgam releases between 3 and 17 micrograms of mercury per day. And we're allowed to have 7 on the average 70 kilogram male or female. The human body has no direct mechanism for excreting mercury actively, and thus it accumulates during the life. A half-life of a drug is how much time it takes for that drug to be removed from your system. So if you give somebody a sulfur drug, and the half-life is 12 hours, let's say, and the person has a rash, and they say, when is this medicine going to be out of me? I'll say, okay, 5 half-lives. It takes 5 half-lives for the drug to be out of your system. 5 times 12. You're going to have 60 hours. You won't have any problems with the sulfur drug being in your system. The half-life of mercury is up to 20 years. So when you have tuna, or you have shark, or you have even small amounts of mercury, it takes 20 years to get 20 times 5, 100 years for it to get out of your system. If you don't put a magnet in it to pull it out. And you're saying, well, I've had tuna and I'm not sick. Well, you don't have the same immune system as some of these kids do. But you do have risk for cancer, and you do have risk for age-related diseases and arteriosclerotic disease. So I would absolutely try to avoid mercury. Mercury has a high affinity for sulfhydryl groups. That's why alpha-lipoic acid is a helpful guy. And that's why glutathione is helpful. Because we want to get these enzyme systems working, SOD and catalase, to improve the antioxidant capacity. And it's nice because in the studies that show that SOD, catalase, and glutathione peroxidase will all improve when people do hyperbaric oxygen on a serial basis. You'll actually get these enzyme systems to work better in the body. There have been papers written on this topic, which is another way that hyperbarics helps. So the chelating needs to grab onto and remove. As environmental exposures become more toxic more readily in ASD kids and other kids, this causes more problems with inflammation and inflammatory diseases, and autoimmune diseases. And as I mentioned before, a lot of the people on this planet have an MTHFR problem. So methyl tetrahydrofolate reductase enzyme, SNPs, the polymorphism that exists, leads to people having problems with altered detoxification methods. If they cannot get rid of this, because mom and dad gave them an MTHFR, and this little kid has it, then we have a problem. And to test MTHFR in the States is a very expensive event. So most people don't test MTHFR. And if you do, then you will find out this kid can't methylate well. If you can't methylate well, you can't detoxify well. So you can't keep giving these moms folic acid to prevent neural tube defects and not think, well, if they have an MTHFR, they can't use folic acid in the right way. Maybe we should give them methylfolate or folinic acid. That will be a methylated form of folic acid to get the body to do what it's supposed to do. Because if 35 to 50% of the population have an MTHFR problem, which they do, then all the folic acid in the world is not going to do the job that methylfolate would do. So And I usually consider autism a heavy metal retention disorder because we really see the responsibility